Hi, teacher, people, and classmates. Welcome to a new video. I will talk about of antimicrobial prophylaxis for children with vesicoureteral reflux. My name is Claudio Mar Alvarado Ramos, and my social networks are Twitter, I Claudio Alvarado, YouTube, Claudio Mar Alvarado, and Facebook, Claudio Alvarado. Well, introduction. Vesicoureteral reflux, VUR, is defined as the retrograde passage of urine to the ureters and often RVU prevalence in children with a history of one or more urinary tract infections in 30 and 50%. The first video. Here explain the vesicoureteral reflux. Okay. Applications in medicine. This association leads to the concept that RVU plays a role in the pathogenesis of urinary tract infections. The importance of these urinary tract infections is directly related to the appearance of new renal scars that may compromise future renal function, lead to high blood pressure and complications in pregnancy. This is therapy of vesicoureteral reflux. Okay. Pros and cons. Pros: currently the therapeutic options available are the medical management that includes, basically, antibiotic prophylaxis and hygienic dietary measures and treatment through an interventional technique. Cons: permanent renal damage in children after acute pyelonephritis (PNA) have been estimated to occur in 5 and 20% of cases, assessed by intravenous urography.
I understand our daughter Elizabeth had a urinary tract infection, and our doctor had treated her with antibiotics. Would you be able to give us information about the reflux that was found on the VCUG?
So normally urine flows from the kidneys down the ureters into the bladder. Vesicoureteral reflux occurs when urine from the bladder flows back into the ureters all the way up into the kidneys. This occurs if the valves at the bladder do not work properly. And about 1/3 of children with urinary tract infections have vesicoureteral reflux, which is graded on a scale from 1 to 5. Urine can back up only a short distance, and that would be a grade 1, or all the way up and dilate the ureters into the kidney, and that would be a grade 5. This allows bacteria from the bladder to get to the kidneys, causing kidney infections with back pain, fever, or chill. Repeated or severe kidney infections may cause scarring and rarely lead to high blood pressure or later in life complications during pregnancy or kidney failure.
Well, I should apply in Ecuador first. Constipation has been shown to increase the virulence of fecal bacteria and is also considered the main factor favoring the recurrence of I2. Therefore, the regularization of the intestinal habit is recommended as an important general measure in all children with UVER. This is MAGE. Okay. Second, cross-sectional analytical observational study carried out in 1906 patients with vesicoureteral reflux treated in the pediatric service of the Roberto Hilbert Elizalde Hospital during the 2050 period 2017 with the objective of determining the prevalence of current IVU in this group, and the results we obtained a prevalence of recurrent IFU in patients with vesicoureteral reflux of the 13.42%. And this video.
Is it okay if she doesn't take the antibiotics?
In this country, at this time, the standard of care for children with infection and reflux is preventative antibiotic therapy. This has never been proven. There's a difference between what has been our standard of care and the things that we do know absolutely. In Sweden, for example, the standard of care is to treat children only with antibiotics if they have high grade of reflux. The thinking has been that by keeping the urine sterile, reinfections will be prevented. There are recent studies that suggest that children receiving preventative antibiotics still have breakthrough UTIs, which may be caused by more resistant germs. Also, antibiotics can have side effects such as allergic reactions, stomach upset, diarrhea, or yeast infections, in addition to the nuisance of giving a daily medication to your child over a long period of time. We believe that by checking the urine when Elizabeth has a fever, we will diagnose and treat UTIs promptly, and this may be all that is needed to prevent kidney scarring.
Okay. And the conclusion is, however, there are currently no universal recommendation of the duration of antibiotic prophylaxis, and although its prescription is systematic in children, there is not consensus of drugs, doses, or control modalities.
Vesicoureteral reflux. Vesicoureteral reflux is a condition where urine flows backwards from the bladder to the kidneys through one or both ureters. Grade 1, urine flows back into the ureter only. Grade 2, urine flows back into the ureter and renal pelvis. Grade 3, the ureter and pelvis appear mildly dilated. Grade 4, the ureter and pelvis appear moderately dilated. Grade 5, the pelvis is severely dilated and the ureter appears damaged.
Thank you very much for your attention. Bye.